things that people will remember their whole lives and will talk about and talk about and talk about. Being intubated is one of them.
Yeah.
Childbirth is another thing. But I do want to express that it wasn't uncomfortable. I was comfortable. But I think because of the knowledge that I had, and I am an ex-ICU nurse, and I remember, I thought to myself, now you always just tell your patients to relax. So I remember consciously, making myself relax.
Do you think it was helpful being an ICU nurse in the past and now being a patient, or would you be better off not knowing?
I really don't know but I think it probably helped me because I have taken care of many patients on ventilators.
Mm-hmm.
And, I was always, it's kind of weird to say, but, if someone's on a ventilator, you don't have to worry about them giving, pain medications and other things. Mm-hmm. But it was helpful to get, relaxation medicine. And it was very helpful to have everyone tell me exactly what happened. I wrote what happened, and I remember this. I mean, there's just not a doubt in my mind writing what happened. And then they told me I had a respiratory arrest, and I'm writing, did I have full CPR, and things like that. And I just think it's really important that people need to remember that you can hear. You're definitely, I remember just connecting stuff up, and I thought that maybe it helped me being an RN, being an ICU nurse, but I just really realized how important it is when you're on a vent to really have great nursing care, and it's very scary. It's not uncomfortable, and that was always my biggest fear in life, was waking up on a vent, and it wasn't. Yeah. I wouldn't fear it.
Okay.
Anymore.
I remember that day, and it's a typical day for me operating. I finished this operation, and I got 5 or 6 more to go. And at one point, you're awake and alert and talking with family that you may not recall.
Right.
And the next minute, somebody calls me and says, your patient's been intubated and they're in the ICU. We have to be careful with epidural, not too much narcotic. Up it goes, the phrenic nerve, the diaphragm, we're no longer breathing. Mm-hmm. Have to be intubated versus given a medicine that you may be allergic to, morphine or some such thing.
Right.
Let me fast forward, not too many days forward.
Okay.
And in hindsight, this was a mistake that me and my team made with you. And the thing that I'm going to talk about, and I want you to elucidate for the people listening, is a couple days post-surgery, the tube's out, you're making progress, the wound looks good, there's no sign of any leak.
I'm up walking around.
You're doing your thing, you're sipping on some liquids, you're taking a little calcium pill or two.
I was taking a lot of calcium. It was being put through my NG tube.
Yeah. And famous Dr. Farley is happy and well thinking, we had a problem with the breathing tube, but we should be okay. Mm-hmm. Take it from there, what goes downhill, and what do you sense, and what happens, and how are you feeling through it?
Well, having so many parathyroidectomies, I was well versed and educated on the symptoms of tetany. I had experienced what I would call like slight cases of tetany that I got myself out of. Very readily. I'm in my room, and I'm walking around, and I get back in bed, and all of a sudden tetany came on faster than I have ever experienced it, or ever experienced since. Mm-hmm. And this hand just cramped up.
Okay.
Now your hand doesn't even only cramp up, your muscles. I mean, it's like a Charlie horse. Mm-hmm. And it hurts. It's very, very painful. So I start yelling that I am low on calcium. Mm-hmm. I was yelling at the nurses. Mm-hmm. And you have a sense of impending doom, and your acid-base balance goes off, and you get very alkaline, like someone that's hyperventilating, and then they were like talking to me about, I was hyperventilating. I'm going, no, I have tetany. The other arm goes. Mm-hmm.
Are you still standing upright at this point?
Oh, no, I was in bed when this started happening. Okay. So my other arm goes into tetany. I'm actually yelling at my husband to go get the nurses and get the crash cart in here. I need some calcium, and I need it now. Both my legs, then within just a couple minutes, cramped up.
Cramp straight? They pull into a ball?
Yeah, your feet cramp down.
Okay.
Then I couldn't feel myself breathe. So my intercostal muscles were affected. With the education that I have, I started looking at my EKG. And still nobody seems to be moving fast enough for me.
Sure.
And then, there was a discussion, we can't draw her blood because she's all cramped up and the arterial line's gone, and we can't give calcium through the IV. We don't want to give calcium through the IV. And I guess I just yelled loud enough, and I finally just said, get the intensivist down here. And he came down and took one look at me and took one look at the EKG, and he says, bring the cash card in and we're going to give her calcium now. And it ended up being a real learning experience, I think, for everyone on the floor. they might have even learned some new language, but when you have this, you know that you have it. And my main message about this, and the thing that I would really like to impart about this, is listen to your patients. If you have a patient that has all this MEN history and stuff, don't think that she's hyperventilating. I've had experiences where I've started cramping up and had to call 911, and I went to an emergency room, and they wanted me to wait outside, and I was cramped up this much, and I told the doctor on duty, what was going on. I went to that hospital specifically. I had the ambulance take me there because I'd had my parathyroidectomies there. And the physician refused to pull the records, refused to give me any calcium, told me that I was having an anxiety attack and to breathe through a paper bag. And when I got better, he would see me. In that case, I had already called a very good friend of mine and told her to bring some Valium and some more Tums, because he wasn't believing me. He wouldn't even call my endocrinologist that was on staff there.
And did you we talk about circumoral tingling and fingertips tingling, toes tingling.
Not the time in the hospital, but as a general rule, I do. I get periorbital tingling first. That will be my first sign, and then my hands get tingly, because sometimes with my digestive system, I'm not digesting the calcium.
Right.
It's just sitting in my stomach, and that's what happened the time in the hospital. So I always carry Tums with me.
And does that usually, if you feel the tingling coming on, it takes care of it?
Yes.
Let me go back one more time with that episode in the hospital.
Okay.
When you put a peripheral IV at the Mayo Clinic and every other place around the country, we typically don't give calcium through a peripheral IV because if it leaches out, it causes necrosis. And at Mayo, we've had 29,000 injections, and 5 times we know that it's leached out, and it led to amputation of fingers, digits, hands, whatnot. So it's a terrible problem. But one of the times it's okay to give is a tetany crisis or dysrhythmia. At that crisis time, when you're all bundled up, did we give you calcium through a peripheral vein, or did we start a central line at that point?
No, you gave. I was given calcium through the peripheral line, and then I was given Ativan. You really need something to get the cramping out of the muscles too, and then I had a PICC line put in.
Okay. And with the calcium that was given peripherally and the Ativan, did this melt away, or you're this way for a day?
Oh, no. You can almost feel it going in. Okay. Once that calcium gets in and everything, you start to relax. Okay. And you can feel that, and the pain goes away.
All right. Let me fast forward again now. Over the course of time, you developed some lumps and bumps in the pancreas, and you had part of the pancreas removed.